Year after year, it's a disease women fear most. In fact, it's estimated that 1 in 8 women in the United States will develop invasive breast cancer over the course of her lifetime. Here to explain more about early detection and prevention of breast cancer is Dr. David Mann, Hematologist Oncologist with Baptist Medical Group.
Hi, Dr. Mann. Thank you so much for being here.
Thank you, Brandy, and thank you to WWF for having me on your show.
We love having you here. To get started, will you tell us a little bit about yourself and what brought you to Baptist Medical Group?
Well, I've been in Pensacola for 20 years. I work in oncology and hematology, and you're right, now I'm at Baptist Hospital and Baptist Medical Group. I work with 6 other medical oncologists and radiation oncologists, but really at Baptist we're more a part of a bigger team. Our nurses, our front desk, social workers, dietitians, physical therapists, surgeons, radiologists, we're all part of a big team.
And you keep very busy over there.
We do, thank you.
And October is known as Breast Cancer Awareness Month, which is why we are happy to have you on the show to talk about this. I was amazed that 1 in 8 women will be affected by breast cancer in their lifetime. I did not realize that it was that severe.
It is a common problem, but it's one where I think there's enough awareness in the community to help tackle that problem.
Well, let's start with exams. How often should women be getting these exams? And it doesn't just affect women. I'd like to touch on that too.
That's true. It affects men as well, but most of the screens that we talk about are concerning women. And first what people talk about is breast self-exams. And that's actually more controversial than you think. I still personally recommend that a woman do a self-exam once a month or routinely, but there's a lot of pros and cons about that. I think we all know that that helps detect cancer, that you can pick it up yourself. But then there's also the limitations of self-exams, because there's studies out there that show that changes that do occur can lead to unnecessary biopsies, and actually the studies show that it may actually simply impact the early detection of more benign diseases. And the whole goal of a screen is to detect malignant diseases.
Right, and that's a good point that you make. I know I'm one that as soon as I find something wrong with myself, I'm an overanalyzer, and I'll get on the computer and try to find out what's wrong with me, and that's probably the worst thing I can do for myself. So when doing a self-exam, what is technically normal, and what is something that you should be more concerned about?
Well, there's a lot of things that can be normal. If you look at the guidelines, they'll tell you anything unusual or unusual changes or anything new should seek attention. I think the key is not to rely on self-exams alone, to also rely on other screening tools as well, because it is normal sometimes to note changes with age, with menstrual cycle. It can be normal to have breast tenderness. It can be normal to feel lumps. It can be normal to have asymmetry. So it really is hard to tell you. Just the simple concept, anything unusual should seek attention, and don't rely only on breast self-exams as a screen.
When should you start getting these exams done?
And again, that's also a very hard question to answer. I think the American Cancer Society recommends a discussion with women in their 20s regarding self-breast exams. But again, you shouldn't really just rely on self-exams.
Is there a roundabout number? I've heard a few, but is there any sort of number where you should definitely, okay, now it's time for me to start getting these exams routinely?
Like mammograms too?
Yes.
I think first of all, if you're an average risk, and by average risk I mean not a strong family history, not a personal history, not a genetic breast cancer, which we can talk about later, but an average risk, most people have discussions about breast self-exam in their 20s, but really we talk about mammograms and clinical exams later. I think it's pretty clear that mammograms decrease your risk of dying from breast cancer by about 20 to 30% over the age of 50. So the consensus is routine, once a year, once every 2 year, mammograms over the age of 50. I think that's pretty clear. Under the age of 40, there's not much consensus. In fact, most people believe that mammograms don't help. There's not enough information to note that mammograms help below the age of 40, again, for your average risk female. Now, between 40 and 50, it's somewhat controversial. Because then you, again, weigh the limitations of mammograms against the benefits of early detection and early screening. Those benefits are there, but there's more debate over the pros and cons. The American Cancer Society has a strong recommendation for women over the age of 45, but they also feel strongly that women over the age of 40 should at least be offered mammograms and at least have a talk about obtaining mammograms.
Yeah, and you can't ever be too careful. I know I have breast cancer in my family history line. So are there certain steps that you should be taking if you do have that in your family history?
It depends, because family history does, by definition, make you a higher risk and not the average risk woman. So there may be things that you want to do differently. For instance, if you have one first-degree family member, it may raise your risk 2 times. If you have two first-degree family members, or one of those first-degree family members are under the age of 50, your risk may be 3 to 4 times. So overall, your risk for breast cancer, if you have a family history, may be between 15 and 40%. And that does put you at a higher risk. And so maybe you should do things differently. I think it's more clear when you talk about genetic breast cancer. About 5 to 10% of all breast cancers are genetic. And so if you do have a strong family history, you really should think about genetic testing and genetic screening, in which case then mammograms probably aren't the ideal screening modality because they'll miss too many. You might want to think about other modalities like MRIs of the breast and starting at an earlier age.
So you mentioned genetic testing. What other procedures, tests do you offer at Baptist Medical Group for breast cancer?
Well, at Baptist Hospital, we do 18,000 mammograms a year.
Wow.
Each of those are double read. Each of those are read by 2 radiologists. But we also do offer 3D mammogram. We offer the digital mammograms that go with the 3D. We offer ultrasounds. We offer breast MRIs. We offer clinical exams at most of the locations. And we do offer biopsies as well.
Wow, so you offer a little bit of everything. So there's no reason for someone not to get informed.
No, I think it really is critical. I think it's clear that an appropriate screening process will decrease your risk of dying from breast cancer.
And for those that may be already treating their breast cancer, what can they do as far as support groups? I know that can be a really hard time. I watched my grandmother go through it, and a lot of psychological issues, mental, you have the physical changes. Are there support groups at Baptist Medical Group?
There are. We're very fortunate to have a very involved social worker team, and they run a support group every 2nd and 4th Tuesday of the month. And also the American Cancer Society here locally offers support groups, whether it's their Road to Reach to Recovery program, or it's their Look Good, Feel Good program that's offered at all of the hospitals here locally.
Wonderful. That's a great resource. Well, if anyone wants to find out more information, they can give you a call at the office, and the number should be on the screen. Or you also have a Facebook where I know they post stuff all the time.
I think that's true. I don't do Facebook, but I believe that's probably true.
Great. Thank you so much for being here, Dr. Mann.
Well, thank you very much, Brandy. Thanks again to everyone here.